This meeting is being recorded.
Good afternoon and welcome to our virtual program, Should My Child and I Get Genetic Testing? We're very grateful to have genetic counselors with us today, Kathleen Barnes, Lori Simone, and Eliza Zidell. A little bit about our presenters. Kathleen is a certified genetic counselor licensed in New Jersey with 21 years of experience. She graduated in March of 2002 from Mount Sinai School of Medicine with a Master's of Science in Genetic Counseling. She also holds a Master of Science in Electrical Engineering from Polytechnic University. She has worked at Hackensack Meridian Health as a genetic counselor for 9 years with her primary focus in reproductive genetic counseling. Lori Simone is a certified and licensed genetic counselor who provides services primarily in clinical and biochemical genetics. She obtained her master's degree in genetic counseling from Rutgers University and is bilingual in both English and Spanish. In her spare time, she is developing a nonprofit organization to help expand genetic counseling services in Latin America. Eliza Zidell is a board certified genetic counselor. She has been working at Hackensack University Medical Center since 2005. She sees patients with a personal or family history of cancer. She has a bachelor's degree in biology from Yeshiva University and a master's degree in genetic counseling from the University of Maryland School of Medicine. Thank you for joining us today, and I will now turn it over to Lori to get started.
Excellent. Thank you for the introduction. So today we'll be discussing reasons for why your child or yourself may want to get genetic testing. I would like to start off by going over the goals for this webinar. The first thing that we'd like to cover is purposes of genetic testing, the different types of genetic testing that may be available to you and your family, variety of reasons that you may want to see a genetic counselor and or a geneticist, and what you can expect in a typical genetics visit. So before we get started off on the specific points that we wanted to cover today, I wanted to start off by giving some general background information on genetics. So genetics is very important because basically many things about one's health are determined by our genetic information. It is estimated that about 3 to 7% of the general population will be diagnosed with some specific genetic disorder. And we're not talking about common disorders such as like cancer, diabetes, heart disease, and psychiatric disorders. All diseases and medical conditions have some type of genetic components. The only exception to this is trauma. So if someone has a health condition that results from some type of accident, we wouldn't expect that to have a genetic component. And your genes can give a lot of information about a lot of different things, such as if someone has an increased risk for certain health conditions, risk for having a child affected with a specific condition, and can also give information on how to best treat certain types of conditions. To start with some general overview about genes and chromosomes. So our DNA provides the instructions to make us who we are, what health predispositions we're going to have, things like that. And our DNA is very long and it's structured in a variety of different ways in our cells. So all of our cells contain genetic information. Genes are small segments of DNA that provide the instructions to make certain proteins. And so individuals have over 20,000 genes in the body. These genes are structured in something called chromosomes, and normally an individual has 46 chromosomes, 23 that they receive from each parent. When we're evaluating someone for a genetic condition, we're looking for specific variations, variants, or formerly called mutations that can cause disease. It's important to note that not all mutations cause disease, which is why we no longer use the word mutation because it had a negative connotation. So essentially, an individual can have a variation in a gene that does not cause disease, and those are called benign variants. So when we're evaluating an individual for a specific genetic diagnosis, we're looking for what we call pathogenic or disease-causing variants to see if we can give a diagnosis of that genetic condition to an individual. There are a variety of different types of genetic conditions that exist. So I will summarize the main three types. So there are single gene disorders. Single gene disorders is when someone has a specific disease causing or pathogenic variant in a gene that causes a specific condition. Some common examples of these are things like sickle cell anemia, cystic fibrosis, neurofibromatosis type 1 or 2. So in those conditions, an individual has specific changes in either one gene or both copies of the gene that were inherited from a parent that can cause that condition. Another type of genetic condition are chromosomal disorders. Chromosomal disorders are conditions in which an individual has a missing or extra chromosome or missing or extra pieces of chromosomes, which we commonly refer to as microdeletions or duplications, or they can have other types of variations of chromosomes, such as a piece of a chromosome that is attached to another chromosome, or something called ring chromosomes. Some common examples of these are Down syndrome, also known as trisomy 21, 22q11.2 syndrome, also commonly referred to as DeGeorge syndrome, or ring chromosome 22. Because chromosomes can have anywhere from hundreds to thousands of genes, the genes that are affected by a chromosome abnormality can give us information of what potential symptoms an individual may have based on the genes that are affected. The last main category of genetic conditions are multifactorial conditions. Multifactorial conditions are conditions that don't have a specific genetic cause that leads for someone to have one of these conditions. Multifactorial is basically a variety of different genes that seem to increase the risk for someone to develop a disease. So there's no way to test for a specific gene to know if someone has a specific change that causes it. But it's not just the affected genes that increase the risk. In order for someone to develop a disease that is multifactorial, it's a combination of the genetic risk factors as well as environmental factors that can cause the disease. Some examples of these are things like heart disease, adult onset diabetes, as well as a lot of different autoimmune conditions, such as lupus, Hashimoto's, and there are other types of autoimmune concerns. Genetic testing there are many, many different types of genetic tests. Usually, if someone is obtaining a genetic evaluation, the type of testing that we're ordering is called clinical genetic testing. And clinical genetic testing is the use of a laboratory test to examine the DNA of an individual in the context of medical care. Clinical genetic testing has to use specific types of labs that are called often CLIA-approved labs, because they have to have a certain level of expectation in terms of accuracy and validity to make sure that the information that is provided is as accurate as possible. There are more than 77,000 different genetic tests that can be ordered. And because of that, a genetic evaluation is helpful to determine what is the right test for you or your family. The right genetic tests depend on a specific medical or family history concern. So there is no one genetic test that someone can get that can screen for everything. So genetic testing is usually targeted to an individual's symptoms. So we need to know what symptoms the individual has, and then the genetic testing is targeted to those specific symptoms. Results of genetic testing can give us a lot of information, such as it can confirm or rule out a suspected genetic disease. It can help us determine the likelihood of someone developing a specific genetic condition. It can also help us determine if there is a risk for passing a genetic condition off to children. And it can also help with optimizing treatments, which is often commonly used in cancer treatment to determine what treatment may be best used based on some specific genetic markers that can be seen. There are other types of genetic tests that can exist that are not clinical genetic testing, such as in forensics when it's being used to solve a specific case, or ancestry testing, which is more like a fun test to see where your family may be from. So who is typically part of a genetic team? So in a typical genetics clinic, such as the one that we have here at Hackensack, is there's geneticists, and geneticists are trained medical doctors. And so they do go to medical school and they have specialized training in genetics and hereditary diseases. There are genetic counselors, which are healthcare professionals who also have a specialization in medical genetics and counseling. In clinics where there is a biochemical geneticist, there's often a dietitian that can help manage the care of patients who have biochemical or metabolic disorders. There are medical assistants and administrative staff that can help with scheduling appointments. Who are genetic counselors? So genetic counselors are not medical doctors, but they are an important part of the genetics healthcare team. They have a master's degree training and they must be credentialed. So all genetic counselors throughout the United States do need to pass a board exam in order to become accredited. And some states, such as the state of New Jersey, do require licensure in order for them to practice. Genetic counselors may meet with individuals and families before and after genetic testing to make sure that families can make informed decisions. And they can work in a variety of different settings. So here we'll be primarily focusing on pediatrics or clinical genetics, oncology and reproductive genetics, but they can work in other specialized clinics such as neurology or cardiology. So how can a genetic counseling session help you? So if you have any of these questions that have come up, then it's a good chance that it could possibly help you and your family. So do you have questions about a condition that's currently running in your family that it is not multifactorial at this time? Are you considering clinical genetic testing, but you're not sure what the best test is for you or your family and what to do? Do you have difficulty talking about a genetic condition with your family? Let's say that your child was diagnosed with a condition at a very young age and you haven't felt comfortable disclosing that diagnosis to your child, then our team could potentially help, or another genetics team could potentially help you with that. Are you concerned about the risk of a genetic condition that could impact your future children? So you are interested in types of screening that may be available to you to see if there's a potential risk? Are you concerned about symptoms that you yourself have or your child has that may have a genetic cause? And so these are all good potential reasons for why you may seek a genetic counseling session. So a genetic counseling session can help with a variety of different things, such as it can help you understand your genetic risks. And we do this based on your family history or personal medical history, such as helping you to understand your risk for certain diseases or cancer as an example. Explore the different types of tests that are available that may be right for you. What genetic test results may mean for you and your family. What is the impact of having a positive result or even a negative result for you and your family? In some cases, genetic test results can give us information about screening and management. So some positive results may determine that someone should have increased screening or changes in their management to help manage their health care. And it can also help identify resources or educational materials which may be of support to you and your family. So there's a lot of different components that go into a genetic counseling session. So we always start off by discussing the reason for the visit and why you were referred. And we obtain any relevant medical history to guide you through the decision-making process. So we often obtain a very detailed medical history, a detailed family history. We provide general information about genetics, inheritance, and specific genetic conditions that we feel that an individual's health symptoms that they're presenting with may be indicative of a specific type of genetic condition. We discuss risk assessment. So what is the risk of this condition, what this means for you and your family, the risks, benefits, and limitations of genetic testing so that you can make an informed decision of what test you feel may be right for you and your family. Making sure that you're informed in terms of the testing and so that we can get appropriate consent to move forward with testing as well as the coordination of the testing. We can help you interpret genetic test results and help you make decisions based on those results. discuss options for treatment, screening, and management, options that are associated with a specific condition if diagnosed. We can also help provide emotional support, or at least connect you to resources that can help provide that emotional support as well. And in individuals who have a genetic diagnosis, we can help find resources for you and your family or other healthcare providers, support groups, or connect you with other family members who have a child diagnosed with that same condition, or individuals that have the same condition as you may have, so that you have some support that way as well. For conditions where there are changes to management, we can also help provide referrals to the appropriate specialists. An important component of a genetic counseling session is to get a complete family history. So we ask questions targeted to get information about the family history that may be relevant to the reason for referral. But we may also ask questions about other genetic risks that may prompt additional evaluation to make sure that you're getting comprehensive health care. And so as part of the session, we asked a lot of very detailed questions, such as like the ages or date of births of individuals in the family, or causes of death for those who may have died, unusual medical problems and ages of diagnosis, so that we can make an appropriate evaluation and make appropriate decisions of what test may be right for you and your family. So now I will cover some specific components about pediatric and adult genetic counseling and testing. So there are various reasons to see a medical geneticist specialist in pediatrics. So one common referral is abnormal newborn screen results. So in the United States, as well as in many other countries, we screen newborn babies for a variety of different conditions, the majority of which are genetic conditions. Because if we know that a child has one of these conditions, there can be changes to treatment or management to help reduce the risk of some complex symptoms or some long-term impact that can happen from being untreated. And so one of the common referrals we see here are abnormal newborn screens that require additional follow-up. Individuals who have abnormal sexual maturation in terms of like issues with puberty or delayed puberty, neurodevelopmental concerns such as autism and intellectual disabilities, individuals that are born with birth defects such as cleft lip, cleft palate, craniosynostosis, heart defects, individuals with early onset diabetes that are something that's not typical for someone of their age, other types of heart abnormalities, not specifically heart defects, such as arrhythmias, seizures, individuals who have unique skin findings or patterns. So some findings that we may see that can be potentially indicative of a specific genetic condition are things like cafe au lait macules, when some individuals have many of them present. Unusually tall or short stature compared to other individuals in the family, or significant vision or hearing loss at a very young age. So now we'll discuss some specific common referrals that we see here and why it's a good idea to seek a genetic counseling or geneticist evaluation for these reasons in the pediatric case. The first is autism. So about 5 to 10% of individuals with autism will have a chromosomal variation. So that's what I was referring to as small pieces of chromosomes that may be missing or extra. In identical twins, if one twin has autism, the second twin has a significant likelihood of also having the same diagnosis. So it also basically further supports that there is a genetic component to autism. Up to 40% of individuals who have a diagnosis of autism are found to have a specific genetic diagnosis that predisposed them to develop autism. And testing can typically include a variety of different tests, such as chromosome microarray, that's checking to see if someone has any missing or extra pieces of the chromosome, Fragile X analysis, which can give us information about a specific condition called Fragile X syndrome, multi-gene panel testing, which is looking at a variety of different genes that are associated with neurodevelopmental concerns, and metabolic testing, which is not inherently genetic testing, but can give us information on whether someone may have a metabolic genetic disorder. Another common referral that we see is sensory neural hearing loss. So sensory neural hearing loss is when the abnormality lies between the hair cells of the cochlea and the auditory regions of the brain. And when we're thinking about severe or profound hearing loss, it does affect about 1 in 1,000 infants at birth or during early childhood. About 35% of individuals with sensory neural hearing loss is caused by environmental causes such as congenital infections, postnatal infections, and other types of exposures. However, in the vast majority, 65%, it is because of genetic causes. The majority of cases of genetic causes of sensory neural hearing loss are what we call non-syndromic, which means it only causes hearing loss and no other symptoms. And so there is good recommendations to seek testing for that reason. In the other 35%, it's syndromic, where it causes hearing loss as well as other medical concerns. So having a genetic evaluation for this can give information on whether there may be other health risks for your child aside from the hearing loss. There are also a variety of reasons to see a geneticist for adults. So some reasons include blood disorders, confirmation of positive results on direct-to-consumer testing. So I do know that some individuals may choose to proceed with direct-to-consumer testing that they ordered online and they received a positive result. Often those labs do not use CLIA-approved labs, and therefore they're not considered clinical genetic testing. And in order for medical providers to act on those results, they do need confirmation from a clinical genetic test. So some individuals may come for confirmation of those positive results. Heart abnormalities, kidney disease. So someone, for example, who has significant polycystic kidney disorder may benefit from genetic validation. Organ ruptures such as uterine rupture, neurodegenerative disease, neuromuscular concerns or atypical movement disorders, seizures, early onset stroke that is not typical for someone's age, unexplained complex medical conditions, or a significant family history of sudden cardiac death or other early deaths. I will now be handing it off to Eliza, who will be discussing about cancer genetic testing and counseling.
Thank you, Lori. Happy to talk about a topic that is interesting to me, and I really enjoy seeing patients and talking to patients, so I hope that this presentation is interesting to you as well. Sometimes people say, why should I see a genetic counselor relating to cancer? So here are some reasons that are common. There may be others. One reason is for someone who has a current diagnosis of cancer, but there are specific situations. Sometimes a person has their own history of cancer. Sometimes there's a family history of cancer. And it might be a history that is noticeable, like people who are diagnosed younger than age 50 for cancers that typically occur in adulthood. Sometimes people have a family history of uncommon types of cancer. Sometimes there are multiple people in one family who all have the same type of cancer. And then there are specific ancestries in which we know of mutations that we can look for. Ashkenazi Jewish ancestry is one example, and there are others. The most common types of cancer that tend to run in the family are cancers of the breast, colon, pancreas, ovary, uterus, and kidney. Again, there are others. Next slide, please. Why do we do this? What's the goal? The goal is to identify the risk, usually by doing genetic testing, then offer options for screening and prevention, and then ideally to keep you healthy. That's where this goes. Next slide, please. What are the causes of cancer? For some people, the instinct when they're diagnosed is to think, what did I do to cause this? There are three broad causes. The most common cause is a sporadic event. It's just a thing that happened, an error. Cells try to multiply normally as we would want them to, and they made a mistake and they grew too much. For many people, that's the reason. For some people, there are factors in the environment. We know about some of them: tobacco, pesticide, radiation. There are probably many we don't know about. And then heredity. Heredity sometimes plays a small role in cancer, and for some people and some families plays a larger role. Roughly 5 to 10% of cancers are caused by hereditary predisposition. So a diagnosis of cancer alone shouldn't lead a person to assume that there's a hereditary cause. But by looking more carefully, sometimes we can get a feeling about whether the cancer is hereditary and maybe due to a genetic mutation that we can identify. Next slide, please. Sometimes cancer is a pattern in the family. This is the typical type of family tree that we would draw when seeing a patient in the office. So we start with the person themselves, and then we move on to looking at their close relatives, their parents, siblings, children, and connect them on the tree. And then we go even further and look at their more extended relatives. In this family, there's the person themselves. In this case, it's a female who's 27 years old. So she gets an arrow pointed to her because in this case, let's say she's our patient. Her mother was diagnosed with breast cancer at 45. Her mother's mother was diagnosed with breast cancer at 55. And her mother's sister was diagnosed with ovarian cancer. Could that be a pattern? It could be. You can't race to assume that it is, but this is the type of family to whom we would offer genetic testing. We'd offer, in this case, genes like the BRCA genes, which you may have heard of, BRCA1 and BRCA2. A person has 20,000 genes. We don't expect to test 20,000 genes in this context, but we may test genes like the BRCA genes and perhaps others that relate to hereditary breast cancer, ovarian cancer, and other types of cancer too. Next slide, please. Why do we do this, and what's the goal? If you look at an average person has an average risk of cancer, and therefore they need average screening. People need a mammogram, colonoscopy, a pap smear for cervical cancer, a PSA test for prostate cancer. For each of these tests, there's a designated age and interval frequency at which the tests are performed or advised. A person doesn't need any special history to warrant having these tests at the designated times. But then, within the population, there are people who could benefit from extra testing, a breast MRI in addition to a mammogram, a colonoscopy starting at an earlier age than what's common, surgery to prevent cancer or reduce the risk, or medicine to do the same thing, reduce the risk. How do we know who these people are? Genetic testing can help. Next slide, please. Sometimes people want to do genetic testing just to understand when they look at the family and they say, so many people in this family have been diagnosed with cancer, or it's an unusual story of cancer. What could be the cause? Sometimes people want to do the testing just to understand. Another reason is because if there are some people with cancer in the family, the person with cancer themselves or family members may want to look out for additional cancers. And this is one way that they can do that. It can be valuable information for the person with cancer themselves and family members as well. And then finding a genetic mutation, as Lori mentioned before, may change the choice of medication that a person has that's prescribed by their physician, or there may be other reasons, for example, avoiding radiation therapy if there's a genetic mutation that says that that would not be a good idea. Getting genetic testing can be valuable information for a person in various phases. For a person who has not had a diagnosis of cancer, for a person who has a current diagnosis of cancer, or for a person who has been treated for cancer, is no longer having active care, but is looking for future information for screening. Next slide, please. The process of genetic counseling and genetic testing is similar to what Lori mentioned before. What we do is review the person's own medical history. We draw a family tree and talk about the people in the family who have been diagnosed with cancer. We review what will happen with the test, and the person consents to testing if they choose. And then, when the result is ready, usually a few weeks later, we discuss the results. Next slide, please. Here are some pearls of wisdom. Cancer is such an important topic in the life of someone who is diagnosed with cancer or who has a family history of cancer in many situations. And information is abundant. There are so many sources of information. Some of them are valid, and some of them, unfortunately, provide inaccurate information. Here's some information that might be new to you. The ideal in testing a family when it comes to hereditary cancer is to test the person with cancer first. Sometimes that person is not available for testing. They may not be living, they may not have insurance, they may not be willing to do genetic testing, they may be located in a place where genetic testing is not available. When it's not feasible to test the person with cancer first, then we test the closest person genetically to that person. Another piece of information, a mutation or a pathogenic variant can be inherited from a mom or a dad and passed to a son or a daughter. There are exceptions when it comes to this. There's always so many exceptions in genetics. However, broadly speaking, we look at both the mom's and the dad's sides of the family when we're thinking about cancer running in a family. And when a person has a mutation that's identified, the information may be relevant to their son or their daughter. Another piece of information, which isn't specific to genetics, but is relevant to the topic of cancer, is that men can get breast cancer. Sometimes people think that mutations can't be passed between males and females, and sometimes people think that breast cancer is not a concern in men. It's very uncommon for men to have breast cancer, but it does happen. Another piece of information, cost is not usually a barrier for testing. If you're interested in genetic testing, pursue it, and very possibly it will not be the barrier that you might have imagined. Updated testing. If you had genetic testing in the distant past and there was no answer or explanation provided for cancer in the person or the family, come back. We may have updated testing that can help. And then, importantly, a negative genetic test result can't guarantee that there's no predisposition to cancer. Next slide, please. And that's demonstrated or illustrated on this slide. A genetic test doesn't always catch all of the pathogenic variants or mutations in the gene. A negative genetic test says the test is negative for what we tested, but it can't comment about all possible pathogenic variants. It can't comment about all possible mutations. So even with a normal or negative test result, we still advise caution, and that's something that we talk about. Next slide, please. Should you have genetic testing? It's hard to say, in speaking to a group of people, that there are specific rules one way or the other that would tell you whether you should or shouldn't have testing. However, testing may be a good idea in the situation of 2, 2, 2, and 2. 2 people with the same type of cancer in the family, 2 tumors in one person, 2 generations that seem to be affected by cancer where it seems like it's traveling through the family, and too young to be average. If a person is diagnosed with cancer at a younger age than whatever is common for that cancer type, that can be an indicator of predisposition and perhaps can be identified with genetic testing. Some cancers are associated with environmental exposure in most scenarios. Lung cancer is a good example of this. Lung cancer is often associated with a person with a history of exposure to tobacco or other harmful agents. However, we can't assume that that is the cause in all cases, and if anything stands out, as is showing on this slide, perhaps someone was diagnosed at an unusually young age. Perhaps there was no exposure that was identified. Perhaps multiple people in the family was diagnosed. In a situation like that, it's good to talk about genetic testing. Next slide, please. So what should you do? If you think that this might be relevant for you or your family, start here, the Surgeon General's Family History Tool. What the tool does is provide you with the questions to ask family members so that you can try to identify who in the family was diagnosed with cancer, at what age were they diagnosed, and specifically how are they related to you, meaning you know that it's a relative of a family member, but unclear how close they're related, and this tool can help you. If you have any questions, you're always welcome to contact us. Thank you.
Thanks, Eliza. Our next topic, we're going to talk about reproductive genetic counseling and testing. Next slide. So fortunately, most babies are born healthy, but about 3 to 5% of babies are born with some serious birth defect or developmental disability. And of these children, about 50% are due to an identifiable genetic condition. Reproductive genetic testing is available to help assess the risk and diagnose some of these genetic conditions prior to birth. Genetic counselors help parents understand their risks and their options. Next slide. So one big category of reproductive genetic testing is carrier screening for single gene disorders. And the goal of this kind of testing is to identify parents who are carriers for a single gene recessive disorder who are at risk of having an affected child. So to review, an autosomal recessive condition, which is depicted in the graphic to the right, is a condition that occurs when both copies of a gene pair have an abnormality in it, which we now call a pathogenic variant. A carrier for a genetic condition has one copy of the gene with a pathogenic variant and the other copy is functioning fine. And that normal functioning copy is enough to keep the person symptom-free. Everybody, all of us, are carriers for some recessive genetic conditions. And it's always been estimated that we each carry about 5 or 6 recessive genes. Because carriers have no symptoms and mostly there's not a family history for a recessive condition amongst carriers or affected people, a person will never know that they're a carrier unless they get tested through carrier screening. And because the testing is done on the parent's DNA, this testing can be done even before pregnancy as well as during pregnancy. If both parents are a carrier for the same genetic condition, then there's a 25% chance with each of their pregnancies to have that affected child. And this could be very important information to proceed before pregnancy. Next slide. So carrier screening has been a part of prenatal care for a very long time. Starting in the 1970s, women who have African American ancestry were checked to see if they're a carrier for sickle cell disease, and women who have Ashkenazi or European Jewish ancestry were tested to see if they're a carrier for Tay-Sachs disease. And then moving into the 2000s, when the genes were discovered, carrier screening for cystic fibrosis and spinal muscular atrophy were added, in addition to several other conditions that are common among people with European Jewish ancestry. And since that time, this basic panel has remained the standard of care for most OBs. However, it's important to know that this is really just the tip of the iceberg. This is 3 conditions out of approximately 2,000 recessive conditions that we know about. And with the basic testing, they're usually only checking for a few specific points within each of the genes they're looking at. So it certainly can't detect all carriers. Furthermore, these 3+ conditions that are the standard panel really don't work very well for patients of diverse and minority ethnic populations. Next slide. So there's a new way to do this, and it's available because of some really amazing new technology that's called next generation sequencing, or next gen sequencing. And this allows us to do expanded carrier screening. And the reason is this next gen sequencing platform allows us, the labs, to test hundreds of genes simultaneously. Also, the testing that gets done on the genes is sequencing. So that's a lot more thorough checking of a gene than the traditional method of just looking at a few hotspots or point mutations. Now, these panels, you can check yourself to see if you're a carrier for more than 500 different recessive conditions. This new style of testing is a big improvement, especially in our diverse populations. Believe it or not, the cost is pretty much the same or similar as doing a standard gene by gene test. And the testing is recommended that it should be offered, and that's a key word. All genetic testing is optional, but the American College of Medical Geneticists and Genomics recommend that these tests are offered to all patients. Next slide. One really compelling reason to do carrier screening prior to pregnancy is a special type of genetic test called pre-implantation genetic testing. And for this, I'm talking about for single gene disorders now. And this is a test that's done on a 5-day embryo. It's not simple. What's involved is undergoing an in vitro fertilization process, which probably a lot of people know about, but basically, a special doctor can remove eggs from the woman and sperm from the man, and the embryos are fertilized in the lab. When the embryos are about 5 days old, they can remove about 5 to 10 cells from the embryo without damaging it, and they can test the embryo for a specific genetic condition. Now, it's important to know this is only done with upfront knowledge that there is a gene that you have to look for, because this very specialized test requires customization for the individual couple. However, imagine if you have 10 embryos in the lab, they're all tested, and then the doctor will know which embryos did not get the genetic disorder. And that would be the embryo that they could transfer to the uterus for your pregnancy. And it's about 98% accurate. Patients who want a definitive result would still need a diagnostic test, which we'll discuss later. However, this is a really amazing way to significantly lower the risk for a carrier couple to have an affected child. Next slide. So moving on to another category of genetic conditions is screening for chromosome disorders. And an important word here is screening, Screening is a kind of test that can assess the risk for a condition, but it's never definitive. There can be false positives, there can be false negatives. And if any patient feels the need to have a definitive result, that's where diagnostic testing comes in. Chromosome disorders is a big group of conditions, some very common, such as Down syndrome, and some, very, very rare chromosome disorders. As a group, this is a major cause of intellectual disability and birth defects. Most chromosome disorders are sporadic, meaning they're not inherited. The risk for some chromosome disorders does increase with maternal age, but a chromosome disorder can affect anybody's pregnancy. We do have a really great new technology. It's been around for more than 10 years now, but it uses a process called testing of cell-free DNA in maternal circulation. And this new screening test can identify 99% of the pregnancies who are affected with Down syndrome. Again, there can be false positive, false negative. If it's positive, confirmatory testing is necessary to be sure. And this testing should be offered to all pregnant women. Next slide. And now we have our diagnostic category of testing. This can be done for both genes and chromosome disorders. This is the kind of test that provides a patient with a definitive result for the condition tested. This kind of testing does require getting a sample of genetic material from the pregnancy, which can be done via a procedure in the first trimester called chorionic villus sampling, or amniocentesis in the second trimester. Both of these procedures do have a small procedure-related risk for miscarriage, and they are optional. The testing that gets done on the genetic material really depends upon the indication. Anyone can have diagnostic testing for chromosome disorders, and it should be offered to all patients who want it. Testing for single gene disorders can only be done when it's known up front that the parents are carriers, because again, there are 20,000 genes and we need to know where to look. Additional genetic testing is available in situations when indicated, such as prenatal ultrasound abnormalities. We can do more extensive testing in those cases. What we cannot do yet is test for all genetic conditions, and this is just still part of the human condition and our current state of technology. Next slide. So what are some reasons that someone might want to come for reproductive genetic counseling? Well, certainly if there's a family history of a genetic condition or a birth defect in the family, and you want information about that and possibly a way to prevent the reoccurrence of that condition in your child. If you have a history of multiple pregnancy losses, if you are a couple who are related to each other by blood, or if you simply want to do expanded carrier screening. During pregnancy, if you have an abnormal prenatal screening result, an abnormal fetal ultrasound, or an abnormal prenatal diagnosis, that's very important reasons to come to see a genetic counselor. Next slide. So just kind of wrapping things up here, next slide. Is genetic testing for you and your child? Well, genetics is a really dynamic field. Every day, some new information comes to us. We're learning all the time. And with that, our options for genetic testing are expanding, but they are complex, and the appropriate test selection should be based on family history, your personal medical history, and other factors. The decision to have genetic testing is very personal, and we hope that our team or any team of medical geneticists and genetic counselors can help you with these important decisions. Next slide. So if you are thinking about coming and you make an appointment, some things to keep in mind. We ask a lot of questions, and having medical records is really can't be, the importance of that can't be underestimated, especially if there is a genetic condition in your family. It would be really valuable to have a copy of that result. Either way, be prepared to discuss your medical history, your family history. If you're coming for your child, we'll ask you even about your pregnancy history and birth history. Our appointments take a while because they're very detailed, so be prepared to be here for about 1 to 2 hours. And if it's appropriate, if you would like to, if you agree, genetic testing can usually be done on that first visit. Next slide. So thank you very much for listening. And I know we have some submitted questions that we're happy to try to answer for you. Thank you.
All right, thank you so much. That was so informative and helpful. We will go to the questions and we'll get to as many as we can, and we'll just keep an eye on the time. But the first question is, how do you go about genetic testing on your own, or do you need to be referred for a reason by your general practitioner?
I can answer that question. So for a genetic evaluation, a specific reason for testing needs to be established, as testing is based on symptoms. Therefore, it is best that a referral is made with relevant records so that we can provide the best level of care and the best type of testing for your indication.
Okay, next question. My child was just diagnosed with ADHD. Would it be good to request genetic testing to find out if there are more issues that could arise in the future?
So at this time, there isn't enough data regarding genetic causes of isolated attention deficit hyperactive disorder to warrant a genetic evaluation. However, if a child has ADHD as well as other neurodevelopmental concerns, such as intellectual disability, autism, or a significant history of developmental delays, then we would recommend an evaluation for your child.
Okay, thank you. Next one. Interested in learning about the testing for genetic markers of breast cancer.
There are a number of genes that we know of that relate to breast cancer running in a family. The ones that people hear about the most are the BRCA1 and BRCA2 genes. Those genes were identified in the late 1990s. Since that time, other genes were identified that also relate to breast cancer. At this point, when it looks like cancer is a pattern in the family and it includes breast cancer, what we often do is a large group of genes that relate to breast cancer, including BRCA1 and BRCA2, and a number of others.
Okay, thank you. Next question. I guess genetic testing is preferable when parents have a specific disease. At what age of parents' disease should happen to be called as genetic disorder? For example, diabetes at the age of 45 or heart attack at the age of 60?
I can touch on that. So it really depends. So a lot of diagnoses of diabetes are adult onset, and so those are usually considered multifactorial. But let's say, for example, you have a teenager that was diagnosed with diabetes and there's no family history of diabetes, and that may be more suspicious of a particular genetic etiology. Or, for example, a heart attack that would happen at a young age, let's say in like a 40-year-old or a 35-year-old. So very atypical, and that person was generally healthy. At the end of the day, because most individuals who are being referred to our clinic are being referred from a specialist. So usually, for example, if someone has like a family history, for example, a diagnosis of diabetes, then it might be a good idea to ask the endocrinologist, is my presentation of diabetes atypical, where there may warrant a genetic evaluation? Or does my family history of the heart attack at X age, asking your cardiologist, for example, is that atypical that may warrant a genetic evaluation? So those are maybe ways to find out based on that specialist's opinion, whether they feel that it could potentially warrant a genetic evaluation.
Thank you. This question, I'm thinking made it depend on where it's being provided, but once genetic testing is conducted, are the results made available to every service provider in the hospital who sees the child?
I'll take that question. When we see patients here, the genetic test results are entered into the electronic medical record system. So any provider in the HMH network should have access to that. Additionally, we have providers or referring doctors from outside the network. And in those cases, we make certain to send a copy directly to the referring physician. Patients can also obtain their own results through MyChart.
Great, thank you. The next question, what if we don't have family history for the mother due to egg donation? Would genetic testing still work for my children? We hope to find out general information, not for a specific disease.
So,
Do you want me to take that? Okay, you can take that, Lori.
I can answer, that's fine. So like we were saying before, genetic testing is specifically targeted to an individual's symptoms and history. And so if you have a child or someone was conceived using an egg or sperm donor and there's limited information, there isn't a specific test that we can order that can determine are there any potential increased risk. So we would have to have specific symptoms present in that individual that we can specifically target testing for.
Okay, all right, we have time just for a few more. The next one, if a parent is a cystic fibrosis carrier and the other's not, what testing would you suggest for their children and at what age?
I'll take that. So generally, if the question is about carrier testing for any condition, including cystic fibrosis, it's not recommended to do that for minors because being a carrier has no medical impact until the person is of reproductive age and they're planning to start their own family. So that would be an important reason, but not in childhood. If, however, the question is asked because there's a concern of cystic fibrosis symptoms in the child, that would be a different matter. That would be something to talk to the pediatrician about, that concern, for possible evaluation of cystic fibrosis. Testing for cystic fibrosis is not simply done by DNA alone. There's other methods of testing for cystic fibrosis that can come into play.
Great, thank you. The next one, if your daughter who already had cancer, should you still consider genetic testing after the treatments are completed?
In short, yes. There's a lot of information that a person with cancer can learn and family members can learn from genetic testing. Some of it relates to treatment of the cancer diagnosed at that time, but a lot of other information relates to other cancer diagnoses or other people who can be impacted. So I would, in most cases, encourage testing even after the person had cancer treatment.
Okay. And my grandmother passed away from Alzheimer's and my mother currently has it. Should I get tested to see if I have the marker?
That's an excellent question. So we do know a decent amount about Alzheimer's disease in terms of some specific genes that increase the risk. So the most well-studied gene for Alzheimer's disease is a gene called the APOE gene, which is associated with late onset Alzheimer's disease. It's important to note that testing that gene cannot tell someone whether they currently have Alzheimer's disease or whether they will definitely develop Alzheimer's disease in the future. It's really just a risk adjustment. So it can only tell someone whether their risk is higher, the same or lower compared to the general population. So a low risk result on an APOE test does not eliminate the risk for someone to get Alzheimer's disease. And a high risk result does not guarantee you will get Alzheimer's disease. And so it doesn't change someone's clinical management, as treatments do not exist at this time that are influenced by someone's APOE status. It is possible that this may change in the future, and at that point it could be beneficial from a clinical perspective to pursue this testing. It's important to note that if someone does have like a family history of early onset Alzheimer's disease, and that's Alzheimer's disease that presents before age 65, usually often in like the 40s and 50s, then there are recommendations for testing individuals with that type of family history, because that can be particularly informative. Also, if someone has a family history of rare types of dementia, such as Huntington's disease, or familial prion disease, and because those are hereditary as well and warrant genetic evaluation. At this time, if you were to pursue APOE testing, it would be more from like a personal decision to know about whether you've made yet higher or lower risk, not really from a clinical perspective.
Okay. The next one, I had renal cell carcinoma at the age of 29. Are my children at risk? What testing should be done? And then also autoimmune diseases that run in the family are vitiligo, type 1 diabetes, lupus, and MS. Can genetic testing show if my daughters are at risk for these diseases?
Please, I don't know if you want to answer the renal cell carcinoma, and I can take care of the autoimmune part.
Renal cell carcinoma can be part of a hereditary syndrome. In most scenarios, it is not. So it would really more depend on the age of diagnosis, which in this case is young, and also family history. It might be something that you want to review with your primary doctor, or else call a genetic service and ask if a referral is indicated.
In terms of autoimmune conditions, as I was saying earlier in the presentation, it does fall under the category of multifactorial conditions for the most part. Our knowledge of genetics regarding autoimmune diseases is still very limited, and so the likelihood of finding a specific genetic cause is low at this time. Right now, we know that it involves both genetic and environmental factors that increase the risk for someone to develop these conditions. However, in some cases where we would indicate testing is, for example, a child who has a very unusual presentation of an autoimmune condition, then we may recommend genetic evaluation in those cases.
All right, and this will be the last question. I have a genetic mutation, and my mother and grandmother had the same mutation. I was just wondering if you would know why our insurance company denied my son to be genetic testing, and maybe is there particular language that should use for the denial?
Well, this is a complicated question with insurance, and it really depends what the mutation is that you're talking to, whether there's certain clinical criteria that an insurance company requires to be documented in order to approve coverage of genetic testing. In terms of language to use, again, that really depends on the exact scenario. I think the best advice would be to speak with the doctor who would like to order the test for the son, and have them write an appeal letter.
I did want to add to that some insurance companies do require genetic consultation prior to coordination of some genetic testing. And so that could be a potential reason for a denial. And without knowing the details of the specific scenario, it's hard to know what is the specific reason why the insurance company denied it. But again, you can contact the ordering provider.
All right. Thank you so much, Kathleen, Lori, and Eliza. This was so informative. It was excellent. And thank you all for participating today and spending time with us and the questions you asked. Please watch your email for an evaluation of the program. Please take the time to fill it out. We want to hear from you. And also let us know if there's other topics of interest. The link for the recording for the webinar will be included as well. We have several other parent forum webinars that'll take place this year. So please feel free to check our website, www.Hackensack Meridian Health /events to find out more information about those. So I hope you all enjoy the rest of your day, and thank you to our genetic counselors, and thank you to all of you for joining us. Have a great day.
Thank you.
Thank you.